everyone, this is Morgan Riney from the New England QIN-QIO, and I'll be moderating today's webinar. Thank you for joining us today on a webinar entitled Moving Forward. Welcome to the HHQI Cardiovascular Initiative. Before we get started, I'm going to review a few housekeeping items. This call will be recorded for training purposes, and I'll provide you with details on accessing that at the end of the webinar. Phone lines are on mute for the duration of the presentation, and we will take questions at the end, and I'll provide you with instructions on how to unmute your line at that time. So now I'd like to introduce Kathy. I'm sure many of you know her by now, but Kathy is the Connecticut Home Health Lead for the New England QIN-QIO. She's a registered nurse with over 40 years of experience in home health care. She specializes in quality management, improving home health provider clinician outcomes, and reducing acute care hospitalizations for Connecticut home care providers. So please welcome Kathy Roby.
Good afternoon, everyone. What a gorgeous day we have. We have to store these up in our memory for later in November when we look out the same window and all we see is gray and slush and freezing rain. I can't believe we're getting this little break, but I'm planning to enjoy every second of it. Well, I want to welcome you to today's presentation. And first, I'm going to begin by apologizing for the fact that we have to do this because I was unfortunately out on medical leave this summer much longer than I ever expected to be. But I am back, and I am really excited about working much more closely with everyone who has joined into the Home Health Collaborative. I want to just remind everyone that this is a group effort, home health providers coming together to try to work on improving the cardiovascular health, not only of the patients that we serve every day, but also for the cardiovascular health of the communities that we serve, so that we are going to be able to help people who are not only on our active service, but are in the communities that we care for. So that said, let's look at our objectives for today. To begin with, I want to be able to ensure that everyone in the collaborative, and there are actually currently 33 agencies participating, and I want to be sure everyone is able to locate, navigate, and access all the resources that you could possibly need on the Home Health Quality Improvement website. We're going to review and ensure that everyone is clear about the objectives and goals of the HHQI Cardiovascular Initiative. My hope is that within the next 30 days, everyone in our collaborative will complete and achieve milestones 1, 2, and 3 on the Cardiovascular Initiative. They're very simple steps. Register on the site itself, register for your data collection, and download the best practice packages that apply to the goals that you've selected. And then, just because we're all overachievers in home health, right, we're going to hopefully understand the basic steps in the data collection process. What is home health quality improvement? And for those of you who participated in the 8th scope of work, can't believe this, it's 7 years ago already, why are we doing this again? Well, we're doing this again because it worked the last time. It's an excellent method of working together, sharing resources, sharing ideas, and accessing patient and staff education and tools that at no cost to you can do a tremendous impact on improving your outcomes. The data abstraction is minimal. The reporting that you get back is excellent. Why does it matter to you as an agency? Because it will improve your patient care outcomes. It can reduce your hospitalization rate, and it can reduce emergent care. And even more important, in today's brave new world, with our final phase of the 5 stars coming out in January, if we practice the things that we see on HHQI, you will improve your patient's experience of care. So let's go for an exploring little trip. This is the HHQI website. The link, www.homehealthquality.org. If you look at the tabs across the top, if this is your first or most recent trip to this website, you will see right in the very center, Cardiovascular Health. And this is the tab where you will spend the majority of your time. The whole focus of the website is the national campaign to improve cardiovascular health. And you'll also notice throughout the whole website a very intense focus on underserved populations. And we all, every agency in the state of Connecticut is caring for some type of an underserved population. It might be a minority, disadvantaged, low-income population, might be behavioral health. But every one of us, in some way, is working with an underserved population. And so the tools that are in here, you will find, are going to be very helpful to you. So when you first go to the website, you're going to want to look at the cardiovascular health section, and you're going to be asked to set up a password, because they do want to know who's coming onto the website and who is working with them. If you have clicked on that cardiovascular health tab, these are the 6 items that you're going to find in the drop-down. The first item is those cardiovascular milestones that I mentioned to you. They are the steps in participating in the project. Each one is an increasing level of participation. Our goal, as I said, is for everyone in the collaborative to achieve the first 3 milestones within the next 30 days. I'll settle for the new year, but I'd like to get them out of the way before we have to deal with the holidays. The Cardio LAN is the second item in the drop-down. LAN stands for Learning and Action Network. We are a network. 33 agencies in the state of Connecticut have signed on to actively work on this project. And I'm delighted that everyone on this call is one of them. We will be having these monthly calls, and we do actually have our regularly scheduled monthly LAN call next week on Wednesday, when we are going to be talking about patient engagement and actively involving your patient as the driver of the care plan. The third item on the drop-down is the best practices. These are a collection of tools, training materials, videos, posters, little cards and handouts for your staff. All the patient education tools are provided to you in Spanish and in English to make it easier for you to have the best impact on all of your patients. The next link as you go down is the data registry. And I know that in the early months of this project, as I spoke with different agencies and different representatives, the minute I mentioned data abstraction, everybody is bringing out the hex signs. Oh, no, don't think I can participate. I don't have any time or any staff to be doing this. And as I assured everyone who signed up for this project, the data collection that you will do through the data registry is very, very minimal. It will not take a long time. It's very easy to do, and it will not be an expensive, time-costly proposition. The fifth item in the drop-down is the introductory webinar. This was recorded by Cindy Sun and Misty Kevich at the very beginning of the 11th scope of work last year in August. So we're already well into over a year into this project. But the intro webinar reviews the milestones, the LAN project, the best practice packages, and the data registry. And it shows you where you can find all the training and resource education that you need for yourself and for your staff. The last item on the drop-down is called Take the Pledge. No, we're not talking about that 8th grade pledge. I swear I'm not going to drink till I'm 21. Of course, how many of us kept that pledge anyway? But this one refers to becoming an active supporter of the Million Hearts campaign to actively impact and improve the cardiovascular health of people and prevent at least 1 million potential cardiac events. So if all you need to do is to go to the Million Hearts website and sign on. You can do it as an individual, or you can do it representing your agency, simply saying, I support this initiative, and I will do whatever I can do to encourage participation and success. Here are the milestones that I mentioned to you earlier. There is a total of 5 on this list. The very first one is joining the Cardiovascular Learning in Action Network, the CardioLAN. As I said to you, when you are on the home page of the website, you can click on that cardiovascular link. It will give you the drop-down, and then you can register. And that's all you need to do. Identify who in your agency is going to be the champion for this project. It might be you. It might be someone else that you're actively working with. Whomever is going to be the champion for the project, that person should also be registered. You can be registered with them if you choose to be, or you can share a password and a user ID. The second milestone is that you download the Cardiovascular Best Practice Intervention Packages, the BPIPs. For those of you who were actively part of our ACE Scope of Work project, when the HHQI website first came live, if you were part of that, you may find that you already have an existing registration, in which case you can simply update your password. Secondly, you may remember the best practice packages, the BPIPs, from the past. Unfortunately, what you might remember is that Cindy and Misty, when they wrote these, they were a bit of overachievers. And these packages were, some of them, over 100 pages long. Our goal with these monthly, second Wednesday of the month webinars is to take a portion of one of the best practice packages, something we feel is immediately applicable and useful to you, and we will go through that portion of it. Because we recognize that when you download a BPIP package and it's close to 100 pages long and has a unit or a module for every discipline, it's very likely that you're going to do what many others before you have done. Oh my God, I don't have time to read 100 pages, digest it, and then where am I going to find the time to implement it? So what we are doing the second Wednesday of every month is taking one aspect of one of those BPIPs and going over it with you to show you how you can best implement it with a minimum of effort and angst on the agency's part. So what is Milestone 3? Milestone 3 is for you to have completed your data access registration and collected data on 1 month of discharged patients. Once you've done that and closed it, you can download a home health cardiovascular data registry report. And you will find that the data reports are giving you excellent information. The future milestones. Mile 4 is 6 months of reported data, and Mile 5 is to identify that you have achieved improvement in one or more of the outcome measures that you are working on. So let's take another look back on the website. How do you go about joining the LAN? You go to the HHQI website, you're going to click on Cardiovascular Health, and then you're going to click on CardioLAN, which is one of the subheaders. See the big blue button? Just click away on that, and it's going to take you through the registration process. It's very simple and very straightforward. So if you're visiting this webinar today and you're not already an active member, then by all means, click the blue button and join right up. We'd love to have you. We will be doing active recruitment throughout the whole 5 years of this project, and we are happy to have as many agencies joining us as we possibly can. One of the other sections in the Cardiovascular Health tab, as I mentioned to you, are the best practice interventions. The goal as I said, is to improve cardiovascular health. Cindy and Misty have taken as the theme that we are going to learn and measure our ABCs. Aspirin therapy as appropriate, blood pressure control, cholesterol management, and smoking cessation. Those are the 4 focus areas that we are working on. There are BPIPs, best practice intervention packages, one or more for each of these 4 topic areas. There is one on aspirin and anticoagulation therapy, and on our QIN-QIO website, we have the recorded webinars with the slide decks for all of the lands that we have done each month, breaking down the intervention packages for you. There is a blood pressure control BPIP. They actually have 2 of those because, as you can see in the lower center of this slide, Cardiovascular Health Part 1 has aspirin therapy and the first half of blood pressure control, and then Part 2 has the rest of blood pressure control. There are BPIPs on cholesterol management, and there's also an excellent one on smoking cessation screening and education and support tools. Again, if you go to our QIN-QIO website, you will find that you will have access to the recordings of the ones we've done, and an excellent program was done during the summer when I was out by Ann Olson on the smoking cessation topic. Now we're going to talk briefly about the data registry. Again, you have that nice large box there that says click here to register for data access and to begin collecting data. We're going to go through that in a little bit more detail, and I do apologize right up front. This can appear to be a complex process. It truly is not. But if you find it confusing as we go through, I want you to remember one thing above all else. If you find it confusing as we go through this webinar, you're not yet registered for the data registry and your own data access, call me. We'll bring it up on the screen and we will walk through together. And if need be, I will gather 2 or 3 agencies together and I will come out to you. This is not an issue or a concern. I am happy to do this for you. And sometimes 1-to-1, 1 to 2 or 3 at a time works better. But for today, we're going to try and take a walk through and see if you'll get enough information to get registered. Once you have clicked on the screen and said that yes, you want to register, this is what you're going to see. It's going to ask you, and it looks like it might have skipped one. No? Okay. What it's going to ask you to do is to click off, yes, I'm willing to be my agency's account administrator. Having done that, it now has at the bottom of the page a list of specific step-by-step things you need to do. Your actual access is going to be based on the eligible cases from a specific process measure in CASPER. That's how they were able to keep them unique, by linking your agency's name and identifiers to that number of eligible cases. So that way, your data will always be 100% yours and 100% confidential. CMS maintains very high standards for their security. So you will need to go to your CASPER website, select the Reports tab, click the report that says OASIS C Quality Improvement. Select Process Measures 2 Report. They are giving you a begin and end date. It's this specific time period that they need. If you are a newer agency or you have not yet gathered enough episodes to have reports available on CASPER, you will likely not be able to get registered independently. What we will need to do is to contact Cindy Sun directly, and she will help you with the process. So if you are new and small and you're not appearing here yet in Casper, contact me directly. We will set up a conference call with Cindy Sun and we'll work it through. So select the begin and end dates they give you, click on Submit. Go to Reports, find the report, and then go to page 4. On page 4, you will find the measure for prevention pneumococcal vaccine received. The number of eligible cases for that particular measure is the verification number you need to validate your account. You're going to enter that number right here where it says eligible cases. Then you're going to be able to move forward. You're going to click the verify button. You may have to log out and come back in order to get verified. That's a very important message at the bottom. I've had calls from agencies saying, I did what you said, but it didn't work. If you have a problem, log out, log back in, and you will be all set. So now that you have gotten this far, you have now your facility and your administrator name, and you have a message. Your account has been approved. And you can click on the links to download the PDFs that you need. So in order to view the reports, you're going to have to enter your provider number, click on the drop-down, and select a report. Up at the top, it has the approval. That's the statement that you see, and then the reports. Okay? So there you are. There's the HHCDR. That's the Cardiovascular Data Registry right there. This is the data collection screen. So that now that you've arrived at this screen, you want to remember, first and foremost, this is currently the 4th of November. You will not be getting October data. You will not be getting September data. You will be most likely looking at July of 2015. So the data does have some lag time, but you're going to select a year and a month, and that will be the time frame that you're looking at. There's your drop-down for the 2014. You select a year from the drop-down, select a month from the drop-down, and then click the Abstract button. So now the screen is saying to you, you need to select what area you're going to be reviewing for the month of July. If you've not yet started data collection, then what you're going to be doing here is selecting a measure and getting baseline data. Baseline data means where do you stand right now for the month of July 2015. Once you've done that and you've selected the measure you're going to work on, at that point, you're now going to begin to implement some interventions. Let's say that you're going to be doing screening for tobacco cessation, smoking cessation. When you get here, you would click on only the section that you were going to do. No one is asking you to work on all of the measures. All we are asking you to do is to pick one. You can do more if you choose, but only one is absolutely acceptable. Click on that and then move forward. So you're going to decide which one you want for your baseline data, click on it, and then hit the Save button in the lower right. Once you've done that, you're going to come to the next screen. On this screen, you're going to see first that at the top, the year and the month that you're working in, and you're going to have in the center sections reviewed. It will, here, you know on the previous screen, we selected all 4. If you only selected tobacco user, then that's the only thing that would be there. It would say section selected for review, tobacco user. Only the one you clicked on would appear. Once you've done that, you now look at the bar across the middle. You can see there's a patient ID number, start of care date, discharge transfer date. What is going to appear on here is the information about those patients who were discharged in the month of July 2015, whose primary diagnosis, as noted on the OASIS, relates to tobacco. If that's the measure you selected, the only patients that are going to appear in this report are the ones whose primary diagnosis fell under the ones affected by smoking. You're not going to have to go through all your OASIS discharges and select the patient by going through all the diagnoses. OASIS data is being used, and the HHQI programming is already doing all of this screening for you, so that this is dramatically reducing the time and energy and effort you need to put in order to do the data collection. And that's a wonderful thing. So that way you will be able to select a patient. Once you have reached this screen, what you have right now in front of you is all this blue box. What you would actually be seeing when you click on any one of those lines that says Edit, you click on that and your patient data is there. Your provider number, the patient ID, start of care, discharge date, those are there. So you click on that one, and now you have your data collection tool. As you go through, you will see that there's a very limited amount of data that is needed. Your CCN number is already in there because you registered, you logged in. The patient start of care is already in, the discharge date, and their ID number, their date of birth, their gender. These things are in there. And we know that the current payment source for home care was already abstracted because it's an OASIS element. The diagnosis codes are in there because they are OASIS elements. That makes it much easier for you. They are going to ask you to click the choice here, does this patient have both a Medicare and a Medicaid number listed in the record? So you will need to enter a yes or a no. The reason for that is because the dually eligible population is an underserved population and an at-risk population. So given that, they do want to know if the patient in question is dually eligible. So you will need to answer that question. The next few screens are going to show you all the different questions that you might be collecting data for. However, as I said to you, remember that you're only going to be seeing and answering the questions that relate to the measure you selected. On the earlier screen, we had actually shown and selected all of those measures. When you do it, you may have only selected smoking cessation, in which case this question is not going to appear. If you had selected aspirin anticoagulant therapy, then you would need to answer this question for that particular patient. Here are some of the questions for the blood pressure control. And again, you are only answering these if that is the measure you're working on. Putting in the systolic and diastolic on the last day for the episode of care. And then saying yes or no, was there a follow-up plan to improve blood pressure control? These are the cholesterol questions, and I will tell you right up front that very few agencies are selecting the cholesterol questions. And the reason for that is evident right here. What test results were documented in the patient record? It's very difficult to pry out the documentation and the lab test results from a physician office. Because of that, many of the agencies have chosen not to go anywhere near the cholesterol questions, and most of the agencies that are actively working on it are those who are attached to or affiliated with the hospital system. These are the tobacco screening questions. As you can see, there's only these three. Were they screened? Were they a current tobacco user? And did they receive any cessation counseling or intervention? Very simple, yes, no, not applicable questions. So, how do you actually implement this? On the HHQI website, you will find a single sheet of paper that has all the questions for all the measures. You are able to download that and make sure that every single record actually has the questions in it. All you want the nurses to do is when you go to discharge this patient, I need you to tell me the answer to these questions, only the questions that apply to the measure you've selected. So if you have selected smoking cessation, the only two questions your nurses would have to answer is this patient duly eligible? And the A, B, and C, 3 questions, yes, no, or not applicable for the smoking cessation. That's it. They can do that by pulling it out of the record, paper or electronic, whatever you have, and then turning in those simple forms to whomever you designate as being your data collection person. That data collection person does not have to be you, does not have to be even a clinical person. You can save both time and money by assigning the task of actually entering the answers to these questions, which does not require any clinical judgment whatsoever. This task can be assigned to a clerical person who can be shown how to enter the system, select the patients as they appear, and then enter the data, initial off the paper tool, and return it to you. And if you choose to, you will find that this is a faster, easier way of accomplishing the data collection. So, registered for the cardiovascular LAN, registered for the data registry, downloaded your BTIPs, and collected some data for the first month, you have successfully completed all 3 of the first milestones. Relatively painlessly, you've completed the first 3. So, why am I doing this again? Didn't we do this before? Not really. We worked mostly in the ACE scope on improving our readmission rates. However, if we can improve the overall health, and specifically the cardiovascular health, of individuals with ongoing heart disease, COPD, or diabetes, we will, in fact, improve your process and outcome measures, which in turn is going to improve your star rating. And if you improve in your process and outcome measures, the corollary is that you also improve your hospitalization and emergent care rates. So yes, that's the reason why you want to select one or more of those 6 measures that the Cardiovascular LAN is currently promoting so that you too can see improvement in your process and outcome measures and your hospitalization and emergent care rates. Okay, so maybe I've convinced you that you do want to participate more actively, but how exactly? What is it that I have to do? You want to begin by selecting one of the 6 measures. Download the BTIP that relates to that measure. Review the measure itself. Go over the education materials with your clinical supervisors. Pick an aspect that relates to the 6 measure, one of the 6 measures. Pick an aspect out of the BTIP that you're going to focus on. And then you're going to use the tools that they've already given you to educate your staff on what the project is, what the measure is you've selected, and what the process is that you would like to use. You're going to be finding in the BTIPs posters, handouts, graphs and things you can use, staff education, patient education. Use them. They're all free. They're all health literacy level appropriate, language level appropriate, and really very nice things, nice tools, well thought out, well laid out to use for this purpose. And then what? Then we come down to that data abstraction piece yet again. You need to distribute the data abstraction tool to the appropriate staff to insert into all active charts. If you are paper-based, then it simply, mountains of them go to the record room and they put them in all the active charts, and then they're going to need to collect them when those charts are discharged. Potentially, if you want to go back and select baseline data so that you can begin working immediately, if you're going back to July, then you're going to need to pull the discharges for that measure. Now, in order to collect the data, without having to collect the data on 100 discharge charts, because that's how many you discharged in the month of July, it's easier to go to the data abstraction section, to the data entry section of the website, select your measure that you want baseline data for, and let the system sort out which discharges apply to that measure for your agency for the month of July. You might only have 6 or 8 of them there. And if that's all there is, then you only need to gather the data for those 6 or 8 patients and go back to the website and enter it in. In order for your data to be valid and reliable, you're going to need, hopefully, to have at least a minimum of 12. So you would be looking to do 12 records each month. The more you do, the more valid and reliable your data is, certainly. But you only need to do 12 if you have 12 or more, and only need to do the ones that are there if that's all you have. If 6 or 7 is all you have, that's all you can do. But for the back months, to get the baseline data, it's far easier to go in and let the system sort out which patient records of the discharges for that given month apply to the measure that you have selected. That way the system is doing the sort based on the primary diagnosis, and you don't have to expend your valuable, expensive time doing it. So once you've got the data, you're going to get it the tool completed, have someone in the medical record room or the nurses completing the tool, submit all the completed abstraction paper tools to whoever is your agency's administrator. That administrator for this project is then able to either do the data entry themselves, or they can teach a clerical person to do it and have them sit with them and do it. Once you've selected the measure and you've done the baseline, going back into July and August as each month rolls forward, you can begin now to do the staff education, providing them with the patient education tools, and keep circling back every month. Keep circling back as part of your ongoing education. You need to be patient but very persistent. You will find it's going to take at least 3 and up to 6 months to have an impact on moving the measure and showing a positive improvement. There are extensive user guides on how to run and how to interpret all the different reports that are available on the website. When you take your slide deck from this afternoon, you will be able to use, these are live links, all of them. They will take you directly to where you need to be in order to access the user guides for the data abstraction, data entry, and in running and interpreting your reports. In the future, on our regular second Wednesday of the month, we are going to be addressing some topics such as understanding and using your HHQI reports for future process improvement. Another topic we are working on is the PDSA approach to improving your cardiovascular outcomes. These programs are done on the second Wednesday of every month, and you can use them. They are perfectly acceptable for you to use as a staff education, allowing you to check off a month as having provided staff in service with perfectly appropriate topics. You will have a sign-up sheet in your own office, and we can always provide you with names if they have in fact signed up as individuals. If you need additional help, I can always do an agency-specific webinar, an agency-specific conference call. We can bring small groups of agencies here to Qualidine, or I can come to you if you're willing to host some of your peers so that we can have multiple agencies in one location. On-site visits for one-to-one assistance can always be set up, and it isn't reserved only for the larger agencies. We are more than happy to come out no matter the size or location of the agency. You let us know. Give us a call. Let us know what you need, and I will be happy to help you and to walk you through whatever you need. Okay, so at this point in time, what I'd like to do is to open the floor for questions. I believe you need to unmute your phone in order to do that, or you can use the chat box, and I will take a look at that to see what questions you might have. Okay, I'm going to open the chat box and see if there's anything there. There is a link for this particular presentation. It's going to be on the QIN-QIO website, which you can see there on that link that's in the chat box. All of the previous ones that we've done, if you've missed any of them, we are happy to help you. They are all posted on the website there under the Home Health Cardiovascular Initiative. So you can go in there, take a look at those. There is an earlier one that was done on data abstraction. Cindy Sun herself from HHQI actually did one for us, and it worked out actually quite well. We were very pleased with it. Okay, I'm not seeing anyone in the chat box. How do you contact me? If you're having difficulty registering on the website, you can give me a call at 860-632-3724. That's my desk phone here at Qualidine. My cell number, because I am out in the field with agencies quite often, is 860-227-2757. And my email address is kroby@qualidine.org. And as I said, I am happy to help anyone who's having difficulty. Do we have any other questions today? No? Well, I've either put you to sleep or you're all busy watching the sunshine out there. I hope that this has been helpful to you. I will look forward to hearing from anyone who needs assistance with signing up. And as I said, if you would like to get together in groups, we can meet in small groups at either here at Qualidine or with other locations.
All right, everyone. So thank you, Kathy. That was wonderful. We do have one question in chat. How do we contact you? You did that one?
Yep.
Okay. So we got that one in. Oh, I lost my paper.
Very good. How do they?
Yeah. So if you have a question that you'd like to ask Kathy, if you would just press #6 on your phone, we got a new phone line. So you have to press #6 to unmute your individual line and ask Kathy a question.
You will also be receiving a questionnaire after this presentation, and it will ask you to evaluate how we did today. We do those after every webinar because we do like to hear from you what we can change or do better. It matters a great deal to us.
So again, if there's any questions, it's #6 on your phone to unmute your line. Well, if we have no questions, we'll wrap up for today. A few final announcements. As Kathy just mentioned, as you close out of the webinar, you will be directed automatically to our evaluation. If you could please fill that out, we would greatly appreciate it. If you don't have time today or you're sharing a computer with somebody else, we will be sending up a follow-up email tomorrow to anyone that registers. That will include that link to the evaluation. This kind of helps us make sure we're on the right track and getting you guys the information that you need. I put in the chat box earlier the direct link to our PowerPoint slides. They are on our website. I can put that link in chat again. And then you can also, tomorrow when I send out that email, it will also have that link in it again. And on there, along with the PowerPoint presentation, you'll also be able to find a recording of today's webinar, as well as a transcript. So I think that's it for today, right, Kathy?
Yep, that should be it. So please reach out, give us a call if you need anything, and I look forward to talking to you in the future. Remember, next week, 2 o'clock, patient engagement. I hope you'll be on the line with us. Have a great day.